start up this. So I'm going to present a few slides on system dynamics here. Pardon me, here we go. So, you know, I have to, again, apologize to all my colleagues out there who, you know, spend much of their lives working in system dynamics, as do I. Given the time afforded us, we're not going to be able to go in great detail through an understanding of system dynamics. System dynamics, even more so than either of the other two approaches, it's marked not only by a methodology, a set of technical steps and sort of formalisms, but it's marked by a perspective, a way of sort of viewing the world based on feedbacks and accumulations. And I would argue that basic perspective is much of it can be applied to understanding of behavior of any of the three modeling methods, but especially agent-based modeling. You can really understand agent-based models from a system dynamics perspective in a rich way. And it really informs your understanding to be thinking about the feedbacks. And Jeff and I, and recently joined with Alan's help as well, are talking with AnyLogic about a variety of extensions for health. And one of them relates to this area of capturing feedbacks visually about what's going on in the model. But what is system dynamics and what do I mean by feedbacks? We'll talk about feedbacks in just a minute. It's a situation where a given change in a system, let's suppose a rise in your hunger ripples through the system, affecting one thing, affecting another, to either push back against that original change. Think, I grow hungry, and I go and I eat. And, excuse me, that makes me less hungry. That's a case of a balancing feedback. A positive feedback might be a vicious cycle, a case where someone who's struggling loses their job. Because they've lost their job, they don't have money to maintain their car, you know, pay car insurance, and they can't get it repaired. They therefore lose the ability to travel easily. It makes it harder for them to find a job. It makes it even more likely they'll remain jobless. Vicious cycle that they can get in. You could think about similar things with addiction and with poverty, etc. So it's a perspective that focuses on these sort of feedbacks and associated accumulations. But it's also a broad evolving methodology to help us conceptualize, communicate and describe, analyze and manage, especially manage. It's a very strong emphasis on management, feedback-based systems. So system dynamics, even more so than agent-based modeling, offers qualitative and quantitative components. It's not purely about quantitative models. It sees a great deal of value of engaging people early, often and sometimes exclusively with qualitative models. At least I should say certain segments of the system dynamics community see a lot of value in that. These are models that help people. They're thinking tools. They help us think through the implications of our understanding of a system, but don't allow us to simulate over time. Quantitative models do allow us to simulate over time. It's a defined incremental and iterative modeling process that's been applied. Some people have mapped it out in tremendous detail, like Khaled Saeed, that delivers early and ongoing value. It really focuses on delivering value early in the modeling process as well, not just waiting for the big, better model, the big final simulation model, but helping advance understanding early on through use of qualitative modeling techniques. Tends to emphasize participatory work with diverse stakeholders more than the other methods, much more so than either discrete event simulation or agent-based modeling. It tends to emphasize the human feature of modeling, the notion of modeling process as delivering the greatest value rather than the artifact of the model itself, and emphasize the need to work with diverse stakeholders, most of whom are not modelers, to help change people's mental models, to help really build a model that's responsive to needs and that can make a difference. It has a rigorous mathematical foundation, on the other hand. The quantitative models in it can unpack directly. They can be transliterated into ordinary differential equations, which is, one of the oldest formalized types of mathematics, dating back to Newton and Leibniz in past centuries. And so you're building atop the shoulders of giants when it comes to reasoning formally about these models. We have a rich set of tools for analysis that help us understand why models like this behave the way they do, that are based on things like eigenvalue elasticity, can show you which feedback loops are dominant in a model at a given time, in a way that we cannot in general for agent-based modeling or for discrete event modeling. We don't have the mathematical tools right now to analyze those in the same way we can analyze system dynamics models. We can analyze where its points of equilibrium are. We can analyze the stability of those equilibrium, any points, whether they'll be robust if we perturb them. If someone flies into the Saskatoon airport with Ebola, will it be contained? We can analyze those sort of things with the system dynamics model, and we can generalize our understanding of model behavior beyond a particular run in ways we don't know how to with discrete event models and with agent-based models. And it has a variety of software that's evolved in the sense that it uses declarative representations only. The focuses, that is, on the what is being described and less so on the how. A big emphasis on system dynamics and a consistent emphasis. It's rare to see a system dynamics project in my experience without an emphasis some on changing people's mental models, changing how people think about the system. That's seen as a key deliverable. It's not just you give this model and people run it and they get insights about which intervention is better, but you're actually trying to change how they're thinking about the situation. Sometimes that's the thoroughgoing goal. And the idea here is most decisions are based on mental models, and when you're making practical decisions, it's often based not merely on the output of a model, but your mental understanding of how it works, your understanding up here in the head, and system dynamics tends to try to foster more evolved thinking on the part of people about how the system works, and often that's more emphasized, more heavily emphasized. It's far more heavily emphasized there than it is in the other types of modeling disciplines, which tend to be a little bit more focused on the artifact itself, the model. And, the system dynamics literature tends to emphasize cases where people's narrow mental models lead to what's called policy resistance, the tendency of a system in its dynamics itself to push back against and defeat, dilute, or otherwise diminish the gains associated with interventions. And there's a variety of cases that can be cited in the health area to where people's failure to think through different causal pathways led to important oversight. So it's now widely believed that introduction of low-tar cigarettes, which was seen as a big gain, because if you smoke a low-tar cigarette, you're getting considerably less carcinogen ingesting than if you smoke a full high-tar cigarette, I guess. The problem is that people didn't really anticipate its impact on cessation. The fact that what this would mean is instead of quitting, some people now switch to low-tar cigarettes. So instead of stopping smoking, now they're smoking low-tar cigarettes, and it can have adverse effects. And it's believed that by many tobacco researchers, it's believed that this led to, the introduction of low-tar cigarettes led to worse harm. It led to adverse outcomes. In other words, it was a net negative in terms of public health. It was seen as a great chance to make a difference, and it caused real problems. Another example is, cutting cigarette nicotine levels was seen as a way of sort of weaning people off tobacco so they don't feel as impelled to smoke. And of course, people compensate. People smoke more cigarettes, so they smoke them more deeply, and it's believed that too can lead to adverse health outcomes, because when they smoke more deeply, they inhale the smoke more forcibly and get exposed to greater carcinogens. And you can go on and on and on about sort of the effects of narrow mental models, of failing to kind of think through the various so-called side effects of a symptom. And system dynamics is tied in with this goal of trying to get people to think through multiple pathways and avoid thinking about it as the main effects, and avoid simply thinking about the main effects and putting aside side effects, thinking about the full system. So system dynamics tends to emphasize quantitative models, to be sure, but those models, particularly through outputting results, findings over time, by running those models, it shapes our mental models, as captured here in things like causal loop diagrams, for example, qualitatively. And then by observing things in the world, we can refine our understanding of what's going on and then capture that further in our model. So it's very much this idea of sort of ourselves as refining our way of thinking about how the system works. Now, let me focus on cover a few things here. I'm going a little bit slow, and I should probably speed up. System dynamics tends to focus on feedbacks as fundamental shapers of behavior of a system. These feedbacks, where we have this change that ripples around and either amplifies or pushes back against that original change. I gave the example of smoking, of hunger before, or, we could use the example of the spread of infectious disease as a vicious cycle. You have, a certain number of infectives leads to more contacts between infectives and susceptibles, leads to a larger number of new infections, leads to even more infective individuals. These feedbacks are not merely intellectually fascinating or curious. They're of attention because they're fundamental shapers of systems behavior. It turns out at a mathematical level, if you can understand the feedbacks and their operation within a system, you can understand a lot of the key elements of how it behaves. These positive feedbacks, reinforcing feedbacks, things like we call vicious cycles or virtuous cycles, they can lead to a system to be very unstable. It tends to diverge. Think about the number of cases of infection. It blows up. It goes from one person being infected to 2 to 4 to 8 to 16, etc., rising up. These types of reinforcing feedbacks are associated with great instability in a system. You can leave very fast behavior very quickly. And sometimes that can take you to a very bad situation, a situation that's then hard to get out of. And conversely, there are things that are called balancing feedbacks. I gave the example of my hunger. Similar thing with thirst. Similar thing with sleep, as I've learned over the last few days. There's a deficit. Body has homeostatic mechanisms that keep us in balance. And the very notion of homeostasis and its importance at a biological level, and particularly in warm-blooded animals, keep us in balance with respect to the thermal character of the environment, keep us well-nourished, etc. These things are key to maintain our stability, and they allow us to survive at minus 40-degree weather, believe it or not, folks. It allows us to survive, periods of where we're hungry. Our body has ways of compensating, of breaking down lipids to keep us supplied with energy, even if we haven't eaten in a while. Our body has ways of, if we're eating a lot, of storing that up so that energy is available down the road. Feedbacks, these regulatory processes that keep us in balance, or these unstable processes, they define at a fundamental level a lot of what goes on behaviorally. They shape the behavior of the system in profound ways. And with a regulatory feedback, one of these balancing feedbacks, you can keep on knocking the system and it won't be perturbed nearly as much. Think about a situation where you have a thermostat at home, a classic regulatory system. You set the temperature of the house to be at a certain level. You can then go open a window and in will come cold air. Think about us in January here in Saskatoon. And of course, what will happen is the furnace will kick in and it will warm things up. It will counteract that. It will keep it in balance. It allows it to be stable. And instability, unstable feedbacks, reinforcing feedbacks, by contrast, can lead to sort of the big changes we see suddenly over time. So understanding feedbacks is central to system dynamics because it understands them as the fundamental shapers of behavior. System dynamics is also notable for understanding how we think about feedbacks and how we in our shortcomings and kind of reasoning through consistently the implications of feedbacks. Tends to emphasize stakeholder participation, as I mentioned, and the models do admit to formal reasoning and analysis. It can be applied at many different levels of granularity, from the level of within a particular individual to interaction of several individuals to at an aggregate level, understanding populations as a whole without breaking it down into individuals. Now, there's varied applications of system dynamics that reflect this. You'll find models that are qualitative. You'll find aggregate population level models. In the health area, this is most common. You may depict the population as a whole into susceptible, exposed, infected, and recovered. Each one is just a count of the number of people. Or you may find stratified models like that where it's further broken down by age groups, by sex, by ethnicity, for example. It tends to have strict limits on how many categories, or it tends to have stiff limits in terms of the number of categories that you can take into account. It blows up every time you take into account a new category. But stratified models are very common and very useful. You can have models that are articulated at an individual level, but unless you're dealing with a small number of individuals, they tend to become very cumbersome. But some of the earliest system dynamics models depicted interactions between several firms, for example, with the firm's workforces, etc. And there are system dynamics models which are stochastic, but most are deterministic. So I noted the participatory nature. I'm not going to expand on this much here. Just be aware that certain practitioners, and I would highlight Peter Hoffman, for example, as perhaps the preeminent example, have been doing wonderful work applying system dynamics in a participatory context. I've recently been involved with work that also involves Peter Hoffman, Kurt Stange in Cleveland, and others, Ross Hammond, in applying agent-based modeling in a participatory context. And what that really means is sort of bringing together models as boundary objects. Having a model, think of the models we've been working with, a model that depicts people and homes and workplaces, and you can show the state charts. You could show that to stakeholders and get them to talk about it. And you'll be bringing together stakeholders from different backgrounds, various types of nurses, public health officials, folks who are epidemiologists, clinicians, stakeholders from the community. And they can all look at it and visually they can make out enough of basically what it's depicting that they can talk about it in common. So instead of using densely clinical terminology, they can be using the model as kind of a common point of reference to talk about how the system works. And this is a very powerful method, and Peter has written and done some great examples in this area, Peter Hoffman. I think I'm going to leave that, but this is an example of a qualitative diagram in system dynamics. It's called a causal loop diagram. And I like to encourage people here to think about building these, regardless of whether you're building a system dynamics model or an agent-based model. This diagram indicates the interaction of a set of what we call variables that are semi-qualitative. By semi, I mean they have polarity associated with them. So you could talk about a greater number of infectives or a lesser number of infectives. You could talk about a greater number of contacts between susceptibles and infectives or fewer. And it's important that the variables be associated with a polarity. You can't just have a variable color where it's not clear what polarity means. More color. So here, for example, we have links between factors that are posited for the sake of this model to be causally related. Here, there's a link from infectives to contacts between susceptible and infectives. And you'll notice that link is associated, has a polarity, a plus here. What that means is if you increase infectives, all other things being equal, the number of contacts between susceptibles and infectives will tend to be greater than the value it would otherwise have held. Well, that's a multiple. Some people say it very briefly. If infectives goes up bigger than its reference value, then contacts between susceptible and infectives will go up relative to its reference value. That's a briefer way, subject to a little bit more ambiguity. By contrast, you think about the number of new infections. As that rises, the number of susceptibles will tend to be lower than the value it otherwise would have held. Again, all other things being equal. So we can associate these polarities associated with posited causal links. And that allows us to deduce the presence of feedbacks. We can actually apply the rule of signs, and you're advised to do it step by step in many cases. But this is a negative polarity loop because we have one link here that's negative, and so you multiply a plus times a minus, you get a minus, multiplied by a plus, you still get a minus, and so it's a negative polarity link. And what that means is that it's a balancing loop. As the number of new infections goes up, the number of susceptibles decreases, and as that decreases, since this is a plus polarity, if this decreases, contacts between susceptibles and infectives will tend to decrease also. And if this decreases, the number of new infections will tend to decrease. So it's self-limiting. Number of new infections, we have fewer susceptibles, therefore it will tend to have fewer new infections in the future. So this is a balancing loop. This is and there's also positive feedbacks associated with takeoff of infection. Given a diagram like this, we can actually use this diagram to illustrate what a quantitative model is doing over time. Which of these loops is dominant? And you can do that. In fact, there are certain tools that allow you to do that in a visual way. But the most important thing I want to talk about for today is stocks and flows. We introduced this notion of stocks and flows, and you folks have seen it before. So here we have a set of stocks. The population at any one time here is divided into a set of stocks, number of susceptibles, exposed, infectives, and recovered. And we have a separate stock associated with cumulative incidence, which is not number of people, it's an accumulated number of infections that have occurred. So we can have different types of stocks. Each of these stocks is an accumulation. It accumulates over time. And if the inflow is greater than the outflow, the net inflow is greater than the net outflow, the stock will tend to go up. Otherwise, it will tend to decline over time. Tend to go up over time if net inflow is greater than zero, decline over time if the net inflow is less than zero. So these stocks here represent, in this case, the sort of number of people in each of different categories in the population. They represent accumulation. They collectively specify the state of the system, the current status of the population. And at a mathematical level, we call these state variables. We call state variables in a set of coupled differential equations, a set of state equations. They can be measured at an instant in time. They start with some initial value, and thereafter, they are changed by flows into and out of them. We don't specify how they change over time explicitly. They're changed by the flows. If the net flow is greater than zero, they'll be going up. If it's really higher than zero, it'll be going up very quickly, in other words, more slowly, etc. They're shown as rectangles. So we've just seen those. And by contrast, and stocks are very important because they determine the current state of the system. They're central to many phenomena like memory of a system, decay over time, build-up that we see. And they can lead to inertia in a system. A situation, for example, maybe we wipe out new occurrence of diabetes. Wouldn't that be an amazing thing? If we could prevent people in our societies from getting diabetes and developing diabetes. It'd be an amazing thing. But guess what, folks? If we did that, we'd still be bearing costs of diabetes for a long period of time. Why? Because there's a number of diabetics right now. And it would take a while for that stock of current diabetics to be drained, to disappear. It can lead to inertia. It can lead to slow change, to a while before a new reality sets in. Often, ladies and gentlemen, interventions affect flows. Let's think about that here. Watch this diagram. So, if we were to put an emphasis on faster contact tracing for an infectious disease, diagnose infectives more quickly, what would that affect here? Well, it would affect how long it takes for someone to recover, how quickly they recover. If we were to, and therefore to affect this flow, this recovery flow, it wouldn't automatically eliminate the number of infectives today. It would just drain them more quickly and put them more quickly into recovered. Perhaps we, through booster vaccinations, we decrease the amount of waning immunity going on. That would slow down this flow back to the state of susceptible from recovered. Other interventions might focus on hygienic measures to lower the probability of transmission from one individual to another. That would lower this infection flow. We typically are affecting the flows by our interventions. And ladies and gentlemen, that means the stocks lead to a sort of inertia. We can't instantaneously, automatically change the value of the stocks, and they have a certain momentum to them associated with it. And as a result, in part, they give rise to delays in a system. It takes a while to kind of nudge a system to a new state. Finally, there's a set of flows. These are shown here in red, and those are the flows between stocks. They're expressed something per unit time. And you typically measure them over some period of time. You have gallons per minute, or you have million cubic meters per second flowing down. Okay? You have liters per second coming into your bathtub. So here we have these flows, and the flows are what we give equations for within system dynamics, and we're going to see that together in just a few minutes. So here the stocks determine the value of the flows, and the flows dictate the change in stocks. The stocks value at a given time is shaped by its flows. You only give the initial value from then on, it's shaped by the flows. And the flows, the value at any one time is determined by the current value of the stocks. The state of the system determines the value of the flows. So, for example, how many new people are getting infected here is dependent on how many susceptible people there are right now and how many infected people there are right now. Now, in order to capture heterogeneity in a model like this, we subscript it according to the population category. So, for example, we might have I being males and females, or maybe as age categories. We could have I subscript and a J subscript for different ages and for different sexes. So we use what is called stratification, okay? There's a real limit to this. Things blow up really quickly, and it requires changes across an entire model. If we wanted to add not just sex-based stratification, but age-based, we'd have to go through every stock and every flow in this model, in this basic population model, and we'd have to change all of them. By contrast, in an agent-based model, you drag in a new parameter to your model, age, say, or you drag in sex, and you make that modification right there. It's very surgical. Here it requires global changes across the model. So that's not one of their foremost strengths. Okay. Yeah, question. Yeah.
I think it's with respect to the examples that you're just showing.
Yeah.
And this is probably this question, or perhaps the answer that lies in the interface between the system dynamic and agent-based models. But often in the situations of an infectious disease, I mean, there's a number of those who are susceptible, recovered, or immune in any other way are not uniformly distributed.
Indeed.
And often, more often than not,
yeah.
So if there is an outbreak of infectious disease or some upward trend, it results from unequal distributions of those who are susceptible, recovered, or immune in a given geographical area.
Indeed.
And that the outbreak usually would result if the number of susceptible will reach critical it doesn't reach the critical point, and we don't see the outbreaks occurring every day.
Right.
We can see outbreaks occurring every year.
Right.
Sometimes, or some more specific time, and they relate to that geographical cluster.
Yep.
And I'm just wondering whether how is that can be captured
Right.
in the system dynamic model or in a broader sense of
Yeah.
hybrid model.
Yeah. It's a good question. So the question, briefly, so I understand it is, it's nice to talk about a model for the whole population as a conceptual construct, but at a practical level, when it comes to infectious disease, what is going on is often not so much a reflection of the number of infectives, the fraction of infectives across the whole population. It's the number of infectives, for example, in a certain subgroup that may be particularly vulnerable, for example, or maybe particularly notable for having perhaps a larger number of connections. Think about individuals who are engaged in much sexual activity, or think about if we were to think about something like childhood infectious diseases, kids who are in particularly crowded environments, perhaps, or people where there's very low levels of immunity because of not participating in vaccination programs due to ideological or other reasons, or because of lack of access to transportation. So it's not so much about the population as a whole and how many people are vaccinated versus unvaccinated in that population. It's about a neighbor, about a sub-community or a particular social network that shapes it. How can you capture that? And the traditional way of capturing elements of that is through this stratification. So you divide up the area described by the model into a set of different subcategories, where certain of those subcategories, it might be a certain region, for example, have their own distinctive set of susceptible, exposed, infected, and recovered individuals, and perhaps their own distinctive set of contact rates and likelihood of transmission given contact based on, level of safe sex use in that sub-community. Think about commercial sex workers versus others. So you can divide it up into a set of categories, but the fact is that it can get kind of awkward for doing this, particularly when you're dealing with networks, because networks overlap. A person's part of this network and linked in with other people, and so doing that in a network sense can be challenging. And I would say that capturing aspects of heterogeneity is not. You can do it in a system dynamics model, but it's not one of its foremost strengths. It's one of its areas of less strength. We're going to see how a hybrid model can help compensate for that, okay? But broadly speaking, you're talking about subdividing the population into groups and either focusing on one of those groups as the focus of your model or as one of the layers of a set of coupled layers of your model. So you have perhaps your focus in childhood infectious disease is very naturally in children, because many of them have not yet been exposed to it through natural, and haven't developed natural immunity. They haven't yet acquired exposure, and some of them may be unvaccinated. And so there you would have children represented perhaps as the focus of your model, or you'd have children and adults, and there'd be some mixing between the two represented, where a certain amount of contacts are with the other group, and you could capture then the spread of infection between those two groups. Yeah. Yeah. Right. Yeah. Yeah.
How can you then link the system dynamic model and agent-based modeling, let's say, if you want to give a specific example, like network or
right.
Or identify very small subgroup of the population where the outbreak, for example, started because
right.
individuals who lost their immunity did not have immunity, and they happen to went to the hockey game or
yeah. Right.
and they by some kind of chance they happen to be all to be susceptible.
Right.
can you incorporate in the dot aging dynamic model into your system dynamic when you link with a broader population which has nothing to do with what happened in that particular class?
Well, one thing you could do is you could have the broader population representing using a stock and flow model, and you could have a particular subpopulation of interest where it has particularly textured, textured characteristics that you want to capture. You could capture that with agents and have the two interact in the sense that you'd have a count of agents who are infective that would be considered by the infection in the stock and flow model, but then there'd also be agent-to-agent interactions within that subpopulation, for example. So that would be one possibility, and we're going to see in a few minutes ways you could bring the two together. Okay, so I hope that offers a little value. I don't think the conversation is over, but I think it's. But I hope those comments have a little bit of significance. Yeah. Okay. So if we want to capture high SES, low SES population, we could divide it into two groups. Right. So system dynamics models, like agent-based models, can exhibit emergence, situations where the whole is greater than the sum of the parts. I like to talk about system science as being the science of the whole. It's about how understanding wholes that are not merely reducible to the sum of their parts, but rather have their own distinctive behaviors. And we see this very much in system dynamics, surprise behavior, where we get behavior, but it's behavior specifically over time in system dynamics models. We're not looking at behavior over networks or over space typically. It's behavior over time in the models through interactions of stocks and flows. And it can be very powerful, very insightful. You can get tipping point situations where a little bit of extra investment seems to not make much of a difference until a certain point, and then boom, the system changes radically. It's a phase change in the language of physics. And you get a radically different situation. You can get lock-in effects, situations where something takes off. So something where investing a bit of resources up front can make a big difference, but investing them later after the cat's out of the bag, for example, may make almost no difference. So you get a kind of lock-in effect where in one situation, the same investment resource can make a huge difference. Later, it makes almost no difference. And we have models where we've shown this, where, early on, if you could nip it in the bud, stitch in time, saves 9, you can prevent the infection from taking off. But if you invest it later, it makes almost no whit of difference at all once the infection is established, for example. Quite common. System dynamics, this is important, folks. This is a very important trade-off that a lot of people miss. System dynamics gives you, population as a whole, system dynamics gives you a cross-sectional depiction of the population over time, the number of people, but it's not capturing the flow of individuals back in particular individual trajectories. If you're looking for that, you're looking to an individual level model. I did note that the system dynamics is subject to formal analysis, and it can provide great insight into, for example, how long-term behavior depends on parameters. It can demonstrate for you the different types of possible behavior and what feedback loops and causal links are currently dominating current behavior. Now, I would note that because of the ability to formally analyze it, we can actually perform, and this is work I've been doing with Dr. Liu over here, applying formal techniques to be assembled together quickly, for example, and you have new data coming in over time, you can incorporate that data and sort of correct the model's belief of what the current situation is likely to be with the data, take into account that the data is flawed and the model is flawed. So you could sort of nudge the model to sort of reground it in the current situation, so it's not getting increasingly inaccurate over time. It's sort of, so the model thinks the situation is somewhere up here at time 3, but the actual data suggests down here, it immediately corrects the model. The model thinks the model is expecting a number of people infective who are way up here, and and when new data comes in, boom, it recorrects it and projects it out. And a model like this can actually learn in a way over time, in the sense that parameter values can be selected over time. It's sort of a survival of the fittest process that Jushin talks about, where over time certain parameter values are selected out that are more favorable. They survive and they flourish in the sort of model. So everything that goes on in the model over time. So here we're balancing noisy data with fallible model predictions and recorrecting the model. So we can always stay with a model that has incorporated the latest evidence, the latest kind of understanding of the situation, the most recent evidence. So here, one of the nice features about system dynamics is you can create a rough and ready model fairly quickly and then potentially ground it with data. So I'm going to close with this. We're going to have a break and continue on. I just want to mention some notable strengths of system dynamics. Why would you weave it into a portion of your model? Why would you need that? I really should. Man, it has, one of the ways we're going to be using it, very simply, is to capture continuous dynamics of continuous variables. So if you want to capture dynamics associated with blood glucose levels, you want to capture dynamics associated with weight change in a person, or you want to capture dynamics associated with strength of belief in something or fear of certain health effects, you can capture dynamics. It allows for rapid model prototyping. Participatory modeling, there's a set of very rich literature on a lot of your model with writing essentially no Java code. And you can reason formally about the behavior of the model. And there's tools and methodologies to help build intuition building among modelers and stakeholders. So that's system dynamics. Any questions on system dynamics before we break, and then we'll resume and build some system dynamics agent-based hybrid models where we couple the two techniques together. Any questions? Nothing? Okay. Yes.
So you're suggesting starting with, in general, starting with a system dynamics model to lay down some basic principles.
Well,
One approach to
that's one approach for certain contexts. It's a frequent approach that I use, but it's not the only one. There are certain features of a situation that if I see them up front, I won't suggest a system dynamics approach up front. For example, if spatial heterogeneity, dealing with space and mobility is a key factor, I think it would not be sensible to start with a system dynamics model. If as a central network structure, maybe you're seeking to intervene in networks at high leverage points in those networks, I don't think it makes sense to start with a system dynamics model. If you're dealing with, if you want to capture learning in your model and individual decision making in a situated context, think about a model of driving behavior. You want the cars to sort of make decisions about how fast to go based on the curves of the road and so on. It doesn't make sense to impose a system dynamics model. It's just that there are a population where going with a system dynamics model to develop to think through systematically what many of the factors are before then diving into expanding sub-areas of the model, it will be effective in many cases. But I wouldn't say as a general rule, I say start with system dynamics. There's many particular contexts where I think the features are such that starting with a system dynamics model would not make sense. Is that helpful? Okay. Other questions? You go take a 5 or so minute break, and we'll.
Where was that PowerPoint slide deck? What's the name of it?
This one?